A lot of women are really nervous about exercising in their pregnancy, and especially if this is your first pregnancy, you might have some questions about what's safe, what's smart. So that's what we're here to answer over the next couple of minutes. The good news is there's almost nothing that's off limits in your first trimester as long as you feel good. Assuming you have an uncomplicated pregnancy, you always want to check with your OB or your midwife and just keep them posted on your exercise plans, just in case they have any concerns or red flags, specifically pertaining to you and the way that you're exercising. But barring any complications, the current recommendation of the American College of Obstetrics and Gynecology is a minimum of 30 minutes 5 times a week of moderate intensity exercise. So moderate intensity means you're breathing hard, you feel like you're working, but you can still carry on a conversation. That's the recommendation, the minimum recommendation of the ACOG organization. Now, the good news is if you're already exercising at a high intensity, that is considered to be completely safe to continue exercising at a high intensity, barring any specific complications. Now, what you do want to bear in mind is that you need to listen to your body. So in your first trimester, the biggest limitations are probably going to be coming honestly from tummy troubles, so nausea, that kind of thing, as well as potentially shortness of breath and lightheadedness, because of the huge changes in blood volume that's happening. Cardiac output is changing. You also have hormone fluctuations. So most women just don't feel that great. And when you try to go into a high intensity activity, you might find that you're more short of breath or more nauseous or lightheaded than you were a couple of weeks ago. So you really just need to listen to your body in those moments. Take a break for a few minutes, drink some water, let your heart catch up, and then go ahead and go back to your activities. The ACOG also recommends a mix of cardiovascular and strength training. So we definitely want to be preparing the cardiovascular system. We want to be getting your heart rate up. That's good for you and it's good for baby. We also want to be building strength or maintaining strength. So core strength is important, hip strength is important, shoulder girdle strength is important. We really want you to stay strong and even get stronger throughout your pregnancy. We just want you to do it in a way that your body is happy with, where you're not showing any signs of distress. Along those lines, we never want you to exert to the point where you're feeling really short of breath, your heart is pounding, it's begging you for a break, or where you feel lightheaded, like you're gonna black out, where you're feeling nauseous, or where you actually vomit. So, if you're vomiting, you're losing hydration and calories, which you really need in that first trimester, and you're also sending your body into a very intense stress response, which is not great for you or baby to do that repetitively during any of your pregnancy. So if you're having severe symptoms of shortness of breath or, your heart pounding or nausea or lightheadedness, again, you need to listen to your body, back off, take a short rest, drink some water, wait for things to calm down, and then go ahead and maybe try another round. For my intense athletes who really want to keep doing high intensity exercise, I just would remind you that you're not giving this up for your whole pregnancy. It's just during the first trimester when your body is getting used to the hormone levels, it's getting used to the new cardiac function. You want to be kind to it and not push it past the point that it can tolerate safely. So again, you're not giving this up forever. You're just giving it up for a short period of time to let your system catch up to what you want to do. High intensity exercise like running, sprinting, distance running, impact, jump squats, burpees, all that stuff is fair game in the first trimester as long as you feel good doing it. Now, if this is your second or third pregnancy, and especially if you did not intentionally and carefully restore your core and your pelvic floor between your pregnancies, you may notice some differences. So you may notice that you start coning or bulging in your stomach, or your abs don't feel as strong, or your pelvic floor starts to feel heavy or lax. You feel heaviness in the vagina, or even you start to leak during your first trimester. It's totally possible, if you didn't restore your core the first time, that you would have increased symptoms of weakness in the deep core and the pelvic floor on a subsequent pregnancy much earlier than you maybe did on your first pregnancy. Any kind of feeling of laxity or heaviness or bulging or instability through the pelvis and the core, your body is telling you that it is not tolerating that activity well. So remember, you already have relaxin in your system, even in that first trimester. So things are starting to loosen. They're starting to get ready to expand. So yes, we want to get your core strong, but we want to do that in a way that is supporting it and not further damaging it. So again, for subsequent pregnancies, we want to be even more careful of identifying signs that your musculoskeletal system, your nervous system is not tolerating your exercise well. These are scenarios where you definitely want to get in to see a pelvic PT if you want to continue with that intensity of exercise, to assess what's going on and help you to be strengthening and exercising in a way that is building up your core system and helping you have a better pregnancy versus furthering any damage that there might be to that system. So the bottom line is you can keep exercising, you can keep doing it intensely, you can keep doing heavy lifting as long as you're not overly short of breath, you're not feeling too nauseous, you're not vomiting, you're not showing any signs of pelvic instability, urinary incontinence, laxity, feelings of falling out, heaviness, or pain. So listen to your body, stop and take a break if you need to. If you enjoyed this video and found it helpful, please do share it with a pregnant friend. Go ahead and follow me on Instagram and YouTube, and you can see a lot of videos that I have on more ways to keep safe and exercise and workout ideas for every stage of pregnancy. So here's to a happy, healthy pregnancy and beyond.